All right, good morning, everybody. And I would like to introduce you to Glinda. Glinda has been kind enough to come on to visit with me to discuss her journey towards better health and also hopefully to inspire anybody watching this to take away some really important information that will finally help you do what you need to do to finally get to the same place where Glinda is. So Glinda, I would like to just let you start off by telling us a little bit about wherever you'd like to start, but maybe about your health journey and where you were starting from before you ended up with me.
Okay, it's my honor, Dr. Edwards. I want to start with just some mindsets and some beliefs that I approach this with, and it starts with a couple of quotes from my daddy. And he said them all my life, but I didn't always understand them. And one was, if you don't take care of your body, you won't have anywhere to live. And as a little girl, I didn't get that. But later I understood I'm a spirit being and that I needed my body and I needed to take care of it. He also said that if he had known he was going to live this long, he would have taken better care of his body. And I think he said that more for others than he did for himself. But and then I had a mentor, a business mentor, that said, an unhealthy body, you have an unhealthy business. Mm-hmm. So she correlated it. So I guess I lived with my end in mind, thinking I want to bring my best self in my physical health. And it was more about stewardship. And I also have a belief in medicine that you start with a why. And the same way in business, to start with the why approach, living from the inside out versus the outside in. Mm-hmm. And so that symptom approach versus what's causing it or why is this happening has always been very important to me. And it's been a challenge over the years to find healthcare providers that are in alignment with that type of belief system. Not just a Band-Aid, but what's causing that and go to the root. Mm-hmm. And that same belief system in my business, well, let's go to the root, what's causing the success or what's not. So that's kind of the mindset that I entered this with. And I had been basically healthy and living a healthy life till about age 46. And at age 46, things started drastically changing in my body. And I didn't know what it was. Cognition went away. I couldn't even remember the name of my national area. Sleep, extreme fatigue, some irritability, but with no remorse. It was just not who I was. Mm-hmm. And I really thought I had a brain tumor. I mean, I really thought there was something major wrong with me. And about that time, I began my journey with you. You just didn't really know that I was on the journey with you. And that was listening to your recorded conference calls. And
that was a while ago.
14 years.
That way, oh my gosh, time flies.
I took copious notes and I thought, this is something different. And I was researching perimenopause and menopause. So I began that journey. And I went on through a series of 6 different providers and trying to find someone that would even work with me, living where I live. And those providers, I worked backwards. I went to compound pharmacies and said, who are you writing the most prescriptions? And I built a relationship with a pharmacist. And so I felt like the best I could do with what I had. I had sent a director that lived in Kentucky to your practice, and she went, and I thought, well, I can drive to Kentucky. I'll just go make an appointment with Dr. Edwards. And at that time, you're in the window that you had stopped seeing patients. Mm-hmm. And so I was searching. I went through 6 different doctors. That was the best. They were good, the best that we had. I mean, everything from me just asking questions. How are you navigating women through menopause in 2005 as opposed to 15 years ago? Or how are you navigating women through menopause today versus when you started practicing medicine? So I was really interviewing them to try to find someone. And I found a lady that actually was one of my former anatomy students. Wow. That was the best. Wow. In 6 journey, but then she moved to start working. She was a nurse practitioner, mm-hmm. and she moved to work with a doctor that would not allow her to write prescriptions mm-hmm. or practice. Mm-hmm. So I went to her, she referred someone else, and then that person was a bariatric surgeon who left that practice and just trying to go on her own. And I could tell she was getting started, but that was the year, and I think she offered me the best she could. But that was the year I got quite discouraged, and that was I had been doing everything right for a year, embracing the process, but my symptoms and everything wasn't improving.
Mm-hmm.
And then I found you were doing telemedicine, and that I thought I can approach you. I can approach and set the appointment. So when I came to you, I think I said, I know I could be better, Dr. Edwards.
Mm-hmm.
I know I could be better. And you immediately corrected some things, but then you started working with me on a more comprehensive program that I had no idea how much better I was going to be. I had no idea what that was going to look like when I started the journey with you.
Mm-hmm.
And so I just, the process, I feel like that if I could be an encouragement to women, that we have a promise, and a promise of better health or a promise of success. But before you get to the provision of that, there's got to be a process. And after being through so many providers, I really trusted you. And I believe that you're the smartest double board certified internist in 2018. And so I trusted you. I believed that what you had to say was going to work, and that if I embraced the process, I would get the benefits.
Mm-hmm.
And so that was kind of my journey. And in the beginning, I compared a lot to business and to life, that in the beginning, when you make a decision, there's a lot of information load coming toward you.
Mm-hmm.
But that if you will, and you can get overwhelming, but after you get through the beginning, then you start to level out and you get into a system and into a routine. And that's what I'd like to encourage women, is that stay the course on that, and that the process works when you work the process. And I think so many times when we're not motivated to eliminate the bad things we're doing or adding the good things, because we don't see the consequences of that behavior today. But compounded daily, you'll start to see them.
Mm-hmm.
And that's what I'd like to say, that the process works, and you can't keep doing the right thing for 90 days and it not work. I mean, I could see results in 10 days. So I just want to encourage people that maybe embracing the process somewhere else, like I've done in my business life, maybe that helped me to embrace the process to save my body. And maybe learning to embrace the process here will carry over somewhere else for you. Mm-hmm. So that's kind of my journey, and where we are today.
That was very articulate and eloquent, and wow, that was really profound. Thank you so much for that. You said something early on, and I wanted to just come back to that. I made a little note so I wouldn't forget, but you had talked about how you had learned a lot from the telephone conferences that I was giving years ago. I won't get into the details of that right now, but and how instrumental that was for you. I guess what I was hearing is that you were better equipped to then go in and interview clinicians when you were trying to find somebody, because you had enough information to know some of the things to ask.
Well, I can only imagine how you must feel as a internist and in the field of medicine when the majority of medical field, they're symptom driven. Mm-hmm. And whatever the symptom is, we treat that. And when you're a patient and you're in alignment with a whole different way of thinking, go to the core, go to the why, go to the what, that is very challenging to find someone who feels that way. Mm-hmm. So I think it comes to being an independent thinker. It comes down to knowing what you believe and why you believe it, mm-hmm. and to educate yourself and to be an advocate for what you believe.
Right.
Because many of the doctors that I went to, they didn't believe. I mean, my best provider was told, you can't do this. And so you have to really be an independent thinker, and you have to know enough information to at least ask the questions and to know what you're looking for.
Right.
And you equipped me with that. And to know that I didn't, just to know what, to believe what I believed. And so that was, and it was you can't get discouraged in the process because you're going up against a system. And so I operated on trying to live above the line.
Mm-hmm.
And many times I'll draw a line on a piece of paper because I'm grateful for the healthcare system. I'm grateful for trauma care. I'm grateful for emergency care. I'm grateful that I live in a country where we have healthcare. Right. I'm grateful for all those things. However, you can't start to blame or justify. You've got to get in there and stay the course. Mm-hmm. And it was been about a 12, 13-year journey.
You have to be persistent.
You have to be persistent and not give up, because the most important victory you'll ever have is the victory over your body and the victory over your health. Mm-hmm. And so that's what I want to say. It was a process, mm-hmm. but it was worth it. And to stay the course and to keep digging. And even when you're working with the best provider, like Dr. Edwards, you can't always find things quickly either, because you're unpacking and trying to figure out, what is it this woman needs to eliminate? What does she need to add? What does her unique process need to look like for her? So you can't find that in one conversation or one set of labs, or you've got some unpacking to do. So we have to be patient with you. You have to find the right one, and wherever that is for you. And then you have to be patient with her or him. And then you got to be patient with your process. Mm-hmm. But it's worth it. It's so worth it.
You know, I have to point out that it's been, about a year since we worked together?
Yeah.
And so, and you're doing just as well now as you were a year ago. And I guess one of the other things I wanted you to just mention is, what lessons did you learn, and how is it that you've maintained your health so well, even though, we touch base twice a year now. So obviously there were some things that have happened that I wanted you to share as well.
Well, I believe when I eliminated things that were, and I thought I was doing an okay job. I thought I was, but I knew I could be better. And I had done some things over the year that I thought were, okay, but your more comprehensive approach, I didn't realize how the magnitude of it all working together. Mm-hmm. And I think it goes back to, I felt like I was the brand new person in my business. Is that what would I want her to do? I would want her to be obedient to the process. I would want her to trust, and whose voice would she listen to? And within 10 days, I felt, at first it was overwhelming. So let me just say that. Mm-hmm. The information, how we communicate with each other, navigating through insurances and all of that, it can be, that information load mm-hmm. can be overwhelming. But I thought, this is how it is for people in my business too. They're overwhelmed. And how can I help them navigate and get settled into the process? So I knew once I could get settled in mm-hmm. to the rhythm, I could get some systems in place. I could get just a few things. I didn't even know the foods. It was all kind of like really more of a foreign language than I realized. Yeah. And, but once I got through the initial process, it became easier. You mm-hmm. get into, you just have to go, I'm going to do this. Right. I am going to do this. And I'm not going to shortcut. Because in business, if you don't do things daily, you don't see the adverse consequences, or you don't see the good benefits.
Right.
But it's those daily things compounded that right. bring you over here. So I just made a decision. This was going to be my way of life from now on.
Right.
This is going to be, so I didn't stop anything. The same protocol that you put me on, I stayed on. Mm-hmm. And my detox, I stayed on it. I mean, not stayed on it, but I used the protein and supplement. I mean, I used the things that you worked with me on, and I haven't deviated.
Mm-hmm. And I think that's the really important point I guess I was trying to bring up, is that, you know, it's one thing to find the most perfect provider and to do everything they tell you to do, but you have to be your own health advocate and not just get to where you want to go, but do the very difficult work of staying where you finally feel good and not reverting back to some of the things that got you, you know, in the place where you were to begin with, to whatever extent those things are contributing, obviously.
Well, and once you feel, to me, it wasn't a quick fix. It was, I came to you, I know I could be better.
Mm-hmm.
And I want to keep being better.
Right.
And so it wasn't a fad. It wasn't a diet. It wasn't any of that. It was, what can we partner together so that I could be better for the next chapter of my life?
Right.
And the longer I do it, when you see your energy go up, and when you see you're feeling more like you felt 20 years ago, when you feel that you don't want to go back. I mean, even days when it becomes difficult, or maybe through the holidays or traveling, I wanted to prep my food. I wanted to do things because I wanted the benefit.
Right.
It was way bigger than any minor inconvenience. So I just stayed to it, Dr. Edwards. I stayed to your process, and I'm very thankful I have.
Well, I'm thrilled that you have, and you look fantastic. I was telling Glinda before we started, I think I need to go fix myself up.
Oh no,
she looks so fantastic. But then I thought, I don't really think people care what I look like, so it's
no.
I want the information. So
we care about your brain and your
yeah,
heart,
that's right.
and your compassion.
My brain works. That's all that matters. So
and your passion for us, we care about that too. Your compassion and your passion.
Well, I've been on the receiving end of the doctor-patient relationship too, so I completely understand the frustration, and not only from the perspective of a non-physician, but even after I was a physician, I was on the receiving end of a very disappointing process. So that made my passion even greater. So anyway, usually my last question to people that are kind enough to do this is, you know, what would your one piece of advice be to anybody out there that's watching this? And I mean, I think you've made that really clear throughout the whole interview, but I didn't know if you had any final parting words of wisdom for people that are watching our discussion today.
Just wherever you are, to know that your current reality does not have to be your future, no matter what your age is. And when I said to Dr. Edwards, I just know it can be better, I didn't even tell you some of the symptoms I was having, because I just thought that was part of aging, and it's not. It was inflammation. It was other things. And so that your current reality doesn't have to be your future, and to be your own advocate, know what you believe and why you believe it, and no matter who your provider is, how knowledgeable she is, only you can do the process. Only you can do that.
You should be,
and it's worth it.
Speaker if you're not.
Worth it.
if you're not a motivational speaker, you should be.
Oh,
you could do your own daytime talk show. I think this was excellent. This was really excellent, and gosh, it even inspired me. So I really appreciate you taking the time to do this and sharing your journey. Makes a huge difference to everybody watching it, and it reaffirms that I'm doing what I'm supposed to be doing on the earth.
Yes.
I can help people to get to where you are. So thank you so much again, and have a wonderful rest of your day and rest of your week, and we'll be talking soon. Thank you.
Thank you.